I could make you an argument that the greater government involvement, the greater the inflation has been. So my fundamental argument is that it's not the quality of health care in America. We have the highest in the world quality of care. That's why whenever somebody rich gets sick, they come to the Mayo Clinic or MD Anderson or Sloan Kettering or whoever it is. Unfortunately, Americans can't afford to do that. So the problem is the inflation associated with healthcare, a rising healthcare cost, which is making it less and less affordable in every sector of healthcare in America. Front page of the USA Today a few days ago, Medicaid costs skyrocket. It showed a graph last year. Medicaid costs increased by over 10%. No system can maintain that kind of inflation. I don't care how good it is or what it is or who runs it. And talk to Mr. Walker, the head of the Government Accountability Office. He says by, I've forgotten now, 2020, something like that, we'll be paying 70% of our taxes just for Medicare and Social Security. I mean, it's unsustainable at the rate of growth of the expense of costs in health care. I mean, I think most economists would agree with that. So I have modest proposals such as removing the employer aspect of it and giving the individual $2,500 and a family $5,000 of refundable tax credit, to a more radical idea of saying people should be paid by outcome rather than individual procedure. If someone has a chronic illness, which 75% of our health care costs go to 5 chronic illnesses, and that provider takes care of that patient, you pay him for a period of time of that treatment and how that patient quality of their health is at the end of that period, rather than every single MRI, every single CAT scan, every single blood test, every one of them, where, as I said earlier, any doctor will tell you honestly, they all game, or healthcare provider, they all game the system. And so, and in a way you can't blame them. I think medical malpractice reform and tort reform